I think it's important to write articles for nursing journals because it broadens the scope of how we can reach patients. I recently was thinking about this a little bit more, and it seemed like we're taking our care, I guess, beyond the bedside. We typically just think of care at the bedside, and it really is above and beyond and reaches a whole new audience.
I think that it has given me a new sensitivity to the content that's published in the journal. As the editor-in-chief of the journal, I am responsible, part of my role is the responsibility for guiding the content of the journal. And so when Chris and Beth Pesca came to me and were interested in publishing this manuscript on carnitine deficiency, I was pretty interested. As Chris said, there's not a lot of information out there on nursing genomics, and especially in the perioperative setting. So when this opportunity came up, I was anxious to be able to have the opportunity to put that in the journal. I would encourage nurses to publish, first off. I don't think nurses fully recognize the expertise that they have when it comes to implementing and interventions in patient care. I think they should be able to, by publishing, they have the opportunity to share with their colleagues. Publishing can seem like a formidable goal, but I would let nurses know that when you submit a manuscript, what happens is that it gets reviewed by peer reviewers who will offer suggestions on content, organization, maybe grammar, those kinds of things. So when you submit a manuscript, you can expect that you're going to be getting some help. So when I provide feedback for them, I try to provide positive feedback as well as constructive advice that will help them enhance their manuscript. So don't be afraid to publish, and I would encourage it.
The Department of Nursing here at Mayo Clinic has been instrumental in helping me advance my education and my career, especially with when I think about how I've gone about publishing. It really has been helpful to have the resources we have here at Mayo Clinic. Particularly, we have an on-site library here that nurses use frequently. We have a lot of online tools and subscriptions to online journals, which has been an immense help. And probably the thing that goes unnoticed, at least in my mind the most, is that we have so many people here that are peers that really are helpful, whether it's coworkers who just offer advice or help read your article, offering suggestions for grammar or different wording. It's particularly helpful to have people here who have the expertise.
The Department of Nursing has been very supportive. I can't tell you how excited I am that I get the support that I do. Doreen Firsty, the chair of the Department of Nursing here at Mayo, is truly a champion for nurses in advancing their role in whatever way they can through scholarly activities. Being in this role has prompted me to stay abreast of current nursing innovations. And of course, I read all the manuscripts that come through, and so I'm able to bring that information back to my colleagues, and I often do, and use it as points of discussion.
I think publishing has had a profound impact on my nursing career and in the care that I provide. Starting with the care that I provide, it really has opened my eyes to how I can impact patients in a more positive way. I have a better idea of say, the comorbidities that are out there, such as carnitine deficiency, and different obscure sort of health care topics that really can impact the care of a patient. As far as my career, it's really basically opened a lot of new doors for me. I've met a lot of new people because of publishing, and I've been able to explore a lot of different facets of the profession of nursing.
I'm truly amazed at the power that this manuscript has had after being published. But I do have to say that unless that information was taken and acted upon, there would have been no impact. And all that credit goes to the Hellner family. Jeannie and her husband have been relentless in their quest, truly a quest, for trying to find answers to Chris's condition. Chris has had this condition for a long time, and they've been looking for answers for a long time. So without their diligence and perseverance, this would, of course, would not have happened. I would also say that this article just didn't affect them. Jeannie has, one of the reasons that we're here today is because Jeannie wants this story to be shared. And with that, she has also shared and has found other families and individuals who have had some of the same symptoms. And so it's a ripple effect. And with this, hopefully they can find some answers as well.
When Libby first talked to me about a family coming forward and reading the article that Beth Pesca and I published in the OR Nurse Journal, I was really taken aback. It was unprecedented for me because I've never had that experience before. I've always published and I've never heard anything after that. So to have a family write in and say this truly affected me was, in a word, I guess, amazing. And what I keep coming back to is it is really amazing because not only did we hear from that family through letters and email, they came and visited us here at Mayo Clinic for follow-up care, and to really see the impact of a journal and an article being published full circle, again, was amazing.